Hi, HCM 1143, Chapter 7. Wanted to talk to you all a little bit about outpatient care, and this is going to be pretty short. The next few chapters are going to be pretty short because, frankly, you got to read a lot. I'm not going to explain a lot of that to you. So, outpatient care. In the 1980s, it kind of emerged. Remember, that was also kind of the hotbed of managed care coming in, and kind of managed care, which is a few chapters from now. The insurance company will manage your care. It will take the most common treatment for whatever it is you have and prescribe what should be done in a step-like process to reduce costs. So basically, it wouldn't allow physicians to do the most invasive or most expensive treatments before they had exhausted the least expensive treatments. Can be good and bad. It definitely is a control for cost, but if you have something that isn't running the typical course of how that particular ailment usually runs, then you can have a real problem if you're covered by managed care. It could be a headache. So outpatient services kind of gained some momentum in the 1980s. Between 1980s and 2010, it had increased over 50%. So that is a lot of growth in just a few years. So let's talk a little bit about outpatient care. Outpatient care is anything that happens outside of a hospital. So that would include your doctor's visits. Doctor's visits are usually referred to as primary care. They're the thing that accesses care first. Between 75 and 85% of the population only need primary care. They don't necessarily need a hospitalization every year. We're talking about the general population of people who are seeking medical treatment are not the most serious cases. They're not in the dying process. They're not chronically ill. They just need strep throat and an infection and a broken finger. About 3 times a year, people are accessing primary care, and that is taking care of most of their health needs. Okay, so primary care is acting as a point of entry into healthcare. I'm going to my doctor because I don't know if something is wrong. And from there, he's sending me for labs. He's sending me to a specialist. He's sending me to these things, and he's acting as the care coordinator. It is the person who is making sure that I'm going to the 3 or 4 different places to get what I need in order to make an informed diagnosis or a treatment. Okay, so that is also the provider of essential care. When you go to a primary care doctor, they're going to be looking after that ailment and making sure that you get to the specialist, to the surgeon, to the lab, to wherever you need to go to get it all done. But most of the time, poor people or people who are uninsured are accessing their point of entry at the emergency room, and that is the most expensive place to start. But it is because a lot of doctors, one, will require payment for services if you don't have insurance, and sometimes they do not accept Medicaid because it has such a slow or low reimbursement model. And so they're not accepting those non-payment or low payments for services. So that leaves an access problem for primary care if you don't have a lot of money. So that has caused a great loop in the things that are not available. So outpatient care is not just that, obviously. In outpatient care, you've had a growth of all kinds of different niche marketing facilities such as surgery centers, women's centers, birthing centers, rehab centers. I'm at a loss, but there's a bunch of them in your book, which you're going to go all through in a minute. There's a lot of reasons for the growth of outpatient care. One of them is reimbursement. Going back to that model of what is cheapest, a lot of times outpatient options are way cheaper than being inpatient in a hospital. A hospital has a lot of overhead. They're taking care of you 24 hours a day. If you're ailment can be taken care of in 6 hours and you can go home in your own bed without somebody who has to supervise you, be paid to supervise you. That's a lot cheaper. So the next reason that it has grown is tech. We talked about that in chapter 5 with the technology, that so a lot of the things that used to be very invasive and very long are now very short. It doesn't take as long to do a lot of these treatments that it used to do. HMOs, a lot of times are requiring pre-authorization. And again, that goes back to your reimbursement model. They're requiring the least expensive option. So a lot of times that's how outpatient services they're referred to, is because of that. But there are a couple that are real interesting to me on the growth of outpatient care, the whys. One of them is physician autonomy. As managed care comes in and it starts to dictate the clinical path, that means that physicians are losing a little bit of autonomy on how they can do things in order to get them paid for. And so another aspect of that is hospitals. I'm sure you've noticed hospitals are getting bigger and bigger. You might have used to had very small hospitals and very large hospitals in town, and it's becoming very typical that you have hospital systems. You'll have 12 Mercies and 12 St. Anthony's that have satellites rather than 12 different hospitals. And so as that happened, again, that large network has a lot more control than a singular doctor at that time. So what has happened is a lot of physicians have started their own very small and very autonomous outpatient centers so that they're still more in control of the clinical aspects of care. Then there's another thing, and that's the social aspect. Truly, people usually prefer to recover in their own homes. They like their own turf, and they like doing things their way. And the other part of autonomy is outpatient care gives a lot more personal autonomy on how you're going to get better and what you're going to do. And so those are a lot of the reasons for the rise in outpatient care. Like I said, I'm not going to go through each of the aspects of outpatient care with you. There's a ton of that in your book. And I'll see you next chapter.